Now, in this lecture, we are going to discuss dental management with unstable angina and myocardial infarction. As we mentioned in the previous lecture, that unstable angina or the condition of unstable angina is more risky than the stable angina, and this is because the attack or the condition of unstable angina might be developed into myocardial infarction, which is necrosis of the cardiac muscle, which is more serious. Now, how we can give dental management or how we can give dental procedure for patients with unstable angina and myocardial infarction. First of all, elective dental treatment should be postponed. Elective, that means the treatment or dental procedure is not urgent or not emergency. So in this case, any elective dental treatment can be postponed. For example, in case of scaling and polishing, it is not urgent. So in this case, it can be postponed. The patient with history of myocardial infarction, for example, the attack of myocardial infarction occurred within 4 to 6 weeks. So in this case, dental procedure can be given, but with caution, and it is more preferable in the hospital. But if the time passed or time lasts for more than 6 weeks of the myocardial infarction, so in this case, dental treatment or dental procedure can be given safely. However, consultation with the cardiologist or with the physician is important because sometimes the patient or some of the patient with ischemic heart disease may also take antiplatelets or anticoagulants, and these drugs also may need reduction. I mean, the dose should be reduced, or even sometimes may need stopping of the drug. So in this case, actually consultation with cardiologist or physician is important. So any patient with past history of myocardial infarction within 4 to 6 weeks should be dental procedure can be given with precaution or with caution in the hospital, but more than 6 weeks can be given safely, but also consultation is important. The visit for those patients can be divided into pre-treatment at home, preparation of the patient, pre-treatment at dental clinic when the patient arrives to dental clinic, and during dental procedure. So pre-treatment at home, first of all, patients should be given anti-anxiety protocol or stress reduction protocol. This is by giving the patient benzodiazepam or Valium 5 to 10 milligram at night before dental procedure or 1 hour before dental procedure. Actually, the dose could be reduced to 2 milligram to 5 milligram. This is according to the body weight of the patient. Long-acting dermal application of nitroglycerin. As we mentioned in the previous lecture, that nitroglycerin comes in different forms. Could be in the form of sublingual, oral tablet, or dermal application. So we can give dermal application in the form of ointment. So this is for long-acting. When the patient arrives to dental clinic, we can check the vital signs, blood pressure and pulse rate. Very important. Establish intravenous line. This is to prepare the patient for intravenous administration of a drug. And we can give prophylactic nitroglycerin sublingually to prevent anginal attack during dental procedure. During dental procedure, we can use nitrous oxide inhalation. This is a sedative. We can check also the pulse rate, very important, because fear and anxiety of dental procedure may increase the heart rate. Benzodiazepam can be given intravenously because we already prepared the patient. When the patient arrives to dental clinic, we established intravenous line, so we can give benzodiazepam IV. Prophylactic nitroglycerin sublingually also can be given if the dentist expects or we anticipated that dental procedure may produce pain, so in this case we can give prophylactic nitroglycerin sublingually. Pain-free procedure is very important. This is by giving more effective and more profuse local anesthesia. Local anesthesia, it is more preferable to use plain anesthesia, that means anesthesia without vasoconstrictor. However, vasoconstrictor can be added, or we can use local anesthesia with vasoconstrictor, but this should be in low concentration. We can use, for example, the concentration of 0.44 or 0.036 milligram adrenaline in 2% lidocaine in a concentration of 1 to 100,000. This is low concentration of adrenaline. Here, the most important thing, actually, we mentioned in the previous lecture, that the appointment should be in the midday. When you want to treat patient with ischemic heart disease, whatever, stable angina, unstable angina, myocardial infarction, it should be in the midday, what we call earlier afternoon. That means 12 o'clock or half past 12. This is okay. But we have to avoid earlier morning and we have to avoid late afternoon, because in the late afternoon the patient usually gets fatigued and stressed. So the dental management or dental treatment can be given in the midday or what we call earlier morning. In addition to that, the chair, it should be in the semi-supine position, not in the supine position, because this may lead to certain complications. So this is dental management of patient with unstable angina and patient with past history of myocardial attack. Now, suppose that we are going to do tooth extraction and suddenly the patient develops severe chest pain. So in this case, how we can give dental procedure? What is the dental management for such a condition? First of all, stop dental procedure, whatever, tooth extraction, root canal treatment, anyone. Give the patient 1 tablet nitroglycerin sublingually. Nitroglycerin, usually the dose, it is within 0.4 to 0.8 milligram. But usually it is in the form of 0.6 milligram. The dose, I mean 0.6 milligram. We can give the patient 0.6 milligram, 1 tablet, that means sublingually, and wait for 5 minutes. Because the pain or the chest pain of angina lasts 5 minutes or within 15 minutes. If pain does not disappear, check the vital signs, blood pressure and pulse rate. If the condition is stable, give him another tablet, the second tablet sublingually, and wait for another 5 minutes. If pain disappears, either postpone or continue the procedure. If the pain disappears, in this case, either to postpone or to continue, this depends on the condition of the patient. If the patient gets fatigued, we have to postpone. If the patient not still alert and he is not fatigued, so in this case we can carry on dental procedure. If pain does not disappear after the second tablet, they check the vital signs, and if stable, that means normal blood pressure, the pulse rate within the normal range, give him or her another sublingual tablet and wait for another 5 minutes. If pain disappears, either postpone or continue as previously. If pain does not disappear after 15 minutes of giving 3 tablets, nitroglycerin, we have to consider myocardial infarction, because the chest pain in case of myocardial infarction may last more than 15 minutes. So in this case, we have to call the ambulance and to transfer the patient to the hospital and to treat him at emergency unit. So this is the dental management of patients who develops chest pain during dental procedure. And this is the end of the lecture, and thank you for your attention.